What's going on, guys? Um, what's going on, guys? You guys are like fast today. You guys are fast. Bruce Wayne, I know you just asked your first question. You want to get in there? That like pissed me off. That like pissed me off to see your question so quickly in there. Like I don't. I that just like annoyed me. Like obviously I'm here for you guys. Like I'm not here for me. Like just you know what I'm saying. But there was like no. It's like off to the races instantaneously with your dumb fucking question. It's like that's literally like where we're at right now. Let's see. Let me see. Someone let the Telegram group know. Like, put the link in the Telegram group. Sumit, I don't need to know that you're going to sleep. Let's see. Um, let's see. What are you guys up to? Abcom, what are you up to? Nakia, what's going on? Good to see you, Nakia. Abcom, you're not first. You're not first. Bruce Wayne was first. I was just saying, like, so you're coming in right now. I was just saying that, like, I hadn't even started the live stream yet. Like, there's that minute period where, like, I'm getting it ready, but YouTube, like, allows people to join as I'm getting it ready, even though I haven't gone live yet. And Bruce Wayne sticks his dumb fucking question in there. I'm just joking, Bruce Wayne, chill. But, like, usually there's, like, a hello, there's, like, an intro type of, like, you ease into it for, like, 30 fucking seconds before asking your dumb USMLE question. Let's see. Guys, give the video a like. Just gonna let some other people know that we're live right now. You can ask your questions, then I get to the questions right there. All right. All right. I just let Instagram know. It's the first time I've let Instagram know. I don't know. I put it in my story. I just like, why haven't I been doing that? Why didn't I put the link in my story? Why not? Maybe I should have waited for like a day when I'm like less cracked out to like increase my reach, right? Because like I do these live streams and like sometimes I'm like high IQ, sometimes I'm like low IQ. This is like a low IQ day because like I just woke up from a nap and I was like thinking about that literally like 5 minutes ago. How like I'm not biphasic, I'm triphasic with sleep. I'll sleep like 5 6 hours. That's not enough, and then like later in the day I nap before teaching. Otherwise, I'm cracked out, and then I nap like actually again. It was only like 10 minutes, but I napped again after I finished a shitload of teaching. Otherwise, I wasn't gonna be able to do a live stream at all. Let's see, right? Dude, there's so many emojis there. I just like got distracted. That's a shitload of fucking emojis. I had to make sure that wasn't like spam. You're a dude, Assad. I'm assuming you're a dude. I'd rather have some chick leave me like a million heart emojis, right? All right. So let me address Bruce your question here. If you're still in the live stream, guys, give me a like when you're coming in. You're finished 75% done with UWorld. I'll do your audio cubing PDFs and I'll take an NVMe. Is there any chance that I pass the NVMe, or am I wasting my time? Well, I don't know your scores. You said you're only 75% done with UWorld. I'd like to know your scores. 60 plus in UWorld's good, right? 50's borderline, 40's bad. So you're not done with UWorld yet. You could have said you were like, you got first in the chat. You could have easily like just said I'm getting 60% cum. And I'd be like, okay, well, that's like not bad. We're just going to see how your NBMEs go when you finish. When you finish UWorld, I want you to do NBMEs 20 and 21, right? And then we'll see how you go at that point. Let's see. Mariam, what's going on? Div, what's going on? Shivi Dua. Are you new to the live stream here? I don't recognize your name. What are some tips for MCQ questions for MCAT, especially MCAT? I mean, what's the MCAT questions lately? There's nothing wrong with that. I just like, I mean, I'm obviously USMLE. Um, I mean, for MCAT, I stay within my fucking lane. I'm not an MCAT expert, okay? But I've said that for long questions. It's better to go backwards if you get long question stems, okay? I'm not gonna pontificate though about MCAT because, as I just said, I'm not an MCAT expert. Let's see, Robert Constantine, Anakai, hey Mike, Abdul Ram, what's going on from Egypt? Nassan, what's going on, Nassan? Braden, what's going on? Ahmed, good to see you again. Hey, Mike, you said the real deal. It's going to be either just, it's going to be a hypothetical and give me 22, 30, or 30, 32, 33. That is correct. Why do students find it more difficult, even though they score well in their assessments? It's in their head. Okay. I mean, I don't really know what to say at this point. I've inculcated this that the real USMLE and the NBME are the same. So people have to, essentially figure out a way to dissipate fear. So they come up with myths. That's like one thing students like to do is they like to, as per my observations, they come up with myths that like that the real USMLE is magically different, or that certain NBMEs are harder or easier. Or like, I mean, people come up with myths. But I've said a million times that the real USMLE is going to be just, you're going to go in there and it's going to look like UWorld. It's going to look like the free 120 in terms of colors, calculator, lab value. But the questions are the NBME ones in there, superimposed into that interface. So it'll be like doing NBME 32 and half of an NBME 33. Questions are exactly the same. Some students say, but are they? They're longer on the real deal. I've heard they're not longer. Okay, the NBME interface, the questions are wider and shorter down the page. Okay, but the question length is exactly the same. On free 120, if you do it online and UWorld, the questions are narrower and longer down the page. Okay, but same number of words. The questions are exactly the same. Nokia, hit the like button, listen to you getting a crown. How's that for dedication? That's extremely dedicated. Thank you. Yeah, guys, give the video a like. Abcom98. Have you noticed that you're happier on Instagram than have you noticed you're happier on Instagram live than on YouTube? No, I have not noticed that. I think that's also all in your head. People have like some sort of obsession with like my level of like smiling, or I should say non-smiling slash non-laughing. It's sort of like a perennial continuous thing. People have like problems. I think you got to like not concern yourself so much with like the degree to which other people like smile or don't smile. Like I don't know why that's like that would never occupy like 1% of my level of care regarding anything like in life ever. Um well, but you could sort of like, you're comparing apples and oranges at the same time, because on my YouTube lives here, I'm sitting in my room answering dumb USMLE questions. When I'm on YouTube or when I'm on Instagram live, I'm skateboarding on the street, usually going to the gym. So skateboarding, I'm out on the street. So I'm getting like fresh air. It's nice to skate around, movement, freedom. I'm going to the gym. So it's like, that's like recreational. So, and I'm not addressing dumb fucking USMLE questions like I'm doing right now. Let's see. Bura. What's going on, Bura? Real Joyce. What's going on? Truth Teller. What's up? Dima. Hey, Mike. Happy to see you again 2 weeks out. If I need to choose at the evening free time, do NBME Yankee and corrects or your PDFs? I want you to focus pretty much like 8 hours a day on NBMEs right now. And then after you finish NBME questions, yes, you can do my PDFs, especially make sure you said you already did arrows, amino, endo. That's fine. You can do PDFs in the evening. It doesn't really matter which one you do at this point. Cardio, pulmonary, gastro, you've done arrows. I'd say that's most important in the final stretch. Really, Joyce, hope you're doing okay. Dima M, some people told me to do NBME 18 before the exam. Is it somehow special? The answer is no. Truth Teller, so I just checked the prometric dates for my exam, and the last date for step 1 for October is August 16th. Should I do free 120 right now to see if I'm ready for August? I still have 1,300 AMBOSS questions. Well, what about the other NBME exams? Start with NBME 20. Your sequence for going through NBMEs should be 20 to 24 free 120, then 25 through 31. You shouldn't be starting with free 120, nor should you be ending with free 120. Okay, that's actually more baneful. That's a worse decision actually, to end with free 120. That's perpetuated on forums quite a bit. Tama and Dender, can you speak Japanese yet? I've been living in Japan 7 years, and I'm a permanent resident of Japan. Like I can speak Japanese, not like a native, but like I can have like conversations on the street, conversations at cafes. I mean, I don't know what you want me to say. A weak, crazy username I cannot pronounce that starts with EWIK. What if I do old NBMEs only 1 to 30 instead of UWorld plus 20 to 30? That's a good question. The reason I don't have people do the old NBMEs like that, 1 through 19, and I have them do UWorld plus 20 to 31 is because UWorld actually has proper lengthy explanations, and I think people need foundation. Okay, so the old NBMEs don't have explanate like proper explanations. You could use ChatGPT by all means. That could be a way to like integrate, primitive AI with like, possibly modifying. But it's like I don't necessarily think the student has to do that. It's a pass fail step one. That's why I don't see it as a crisis. If we still had a numerical step one, could contemplate something like that. I see it as too much like manual work. I think just doing a QBank, Amboss, or UWorld, finishing it, and then just simply doing 20, 24, free 120, 25, 31. I think that's like generally a pretty good trajectory. Abcom 98. As a guy that likes slash collects watches, lives in Japan, do you have a Seiko, Grand Seiko collection? The answer is no. I have no interest in Seiko. Chanela Nisbet, what's going on? Mike, I hope you're doing great. It's been a while. Has it? I think it has been since you've been in the chat. Maybe like close to a week or something. Let's say. Sammy B, Grand Seiko is garbage. I don't have an opinion either way, and say like I'm not saying it's good or bad. I just wouldn't personally like. Does anyone here like specifically say hell yeah, I want a Seiko? You know what I'm saying? Like the watch can look exactly the same, you know, but it's just like that's not a name that grabs you. Just shows you what branding does. Robert Constantine, got to give you all the credit since I've started reading your PDFs. Not only that everything became easier for the steps, I've even started to like medicine more. Haha. Okay, I mean that's good. Happy to hear that. Robert Constantine, also QBank videos are gold. Thanks. Assad Moment. I've really been doing exactly what you say. Did NBME 20, scored 62%. It's a fail. Do you think this score is good? The answer is no. I just said it's a fail. I want to see like bare minimum 66 usually on the NBMEs. That's like, I say literally bare fucking minimum. Like high 60s are what you should be shooting for. 70 plus is safe. Okay. If students getting like 70 plus on NBMEs, I'm very, very content from tutoring angle. 68 plus is like, okay, good. We like that, but try to do better. 66, I'm like your borderline. And then I really get into like, I want to see your 3 to score conversions hardcore. And like, we got to dance around those and, to debate whether we want to like, which NBMEs want, if we want to continue through the NBMEs, have you do more QBank before going back to NBMEs, etc. 62 is a fail. Close to it's your 190s though. It's not bad. It's not terrible, but it's a mild fail. You can go to NBME 21 next. That's what I want you to do, Assad. I want you to go to NBME 21, and I want to see you obviously do better on that. Krish, hey Mike, is it worth doing NBMEs 2025 as they're retired? 2024 is retired, not 25. 25 is online. The answer is yes. I've said like I don't know 4,000 times at least that you should be doing probably more than that. That you should be doing 20 through 31, including free 120. Moogle 900, hello, from me and the Kins. Jay, how do you study Absgyn for Shelf 2CK when you have zero interest? I guess you just have to if you want to like finish Absgyn and like do medicine, right? You're gonna do obviously the Absgyn questions from UWorld or Amboss, doesn't matter. Just choose one. You don't have to do both QBanks. Just choose a fucking QBank. Number 2, you can do my Obsgyn Repro PDF. Number 3, do my Obsgyn Repro playlist on the YouTube. Those questions. Number 4, you're going to do all 8 CMS Obsgyn forms. Okay, so and you're going to do those twice, and you'll get high pass honors on your shelf. You got to do all that content though. People who like don't get high pass honors, it's because they don't do that content. Guys, give the video a like, come in the live stream. Equahajan Noor, if due to time limitation all your PDFs can't be done, then is it okay to do the high yield ARS PDF only along with your YouTube MCQs question mark? And how many times to go through the high yield arrows PDF? Well, I mean, you can go through it as many times as you want, right? I'd say at least once, though. Most people aren't going to grasp all the concepts the first time they do it. Masad, and by the way, I'm a dude, but I'm in love with your content. Yeah, well, you dropped like a million heart emojis. So, as I said, I would prefer a chick to drop the heart emojis, right? Not a fucking dude. But I appreciate your enthusiasm for my content. HUD, I'm waiting for charted repro PDF. Well, you'll be waiting a long fucking time because I don't have interest in that. I could easily, rather than doing these dumb live streams answering dumb USMLE questions, I could just because it's 5:15 a.m. for me. I said I'm like low IQ crackhead right now, but like rather than that, I could just sit in my room throughout the night after I'm done teaching and work on a world class updated repro PDF. World class. I could have that done in like I don't know, a week and a half, 2 weeks. World class. No fucking interest. Okay, so maybe I don't know, late this year, maybe next year. I'll get around to it at some point, right? I'll get around to it, but right now I don't have interest. Kamal saying, if you want to send me like, a Bitcoin or something, I'll do it. It's like you say, okay, troll. I'm not trolling. I mean, if you send me like a Bitcoin, I'll have that done by like the end of this month because I'm going to New York at the end of this month. So I'll have a world class updated repro PDF done for you and the community by if you send me a Bitcoin. Okay, you can DM me and I'll give you like the address to my hard wallet. Kamal saying how to make connections while in the USA. Well, what you're going to do is you're going to find an institution you potentially want to be at. So you say, I like this, I like X institution. You can't be delusional. Okay. So if you think you're only capable, let's say, of getting like a 250 on the step two, or you already have a score that's like, let's say around a 250, you can't be fucking delusional and think you're going to get into radiology at Yale. It's not going to happen. So you got to be practical as far as, well, I might want to do obsgyn at like, X location. And I'm going to see who like the head of the committee is there, someone on the committee who's more senior. I'm going to find out if I can get that information. And then you're going to research that person, see if they are doing any like presentations or conferences. Sometimes they have like a website, or the hospital will have information as far as like they're giving like a presentation at this this conference, and then you have to go to that conference and you have to meet that person and you have to make connections that way. Meet that person and see if they have another connection. There might be like, you might see them literally talking to like one of their friends at the conference, someone they might know, and you can get in with one of those guys and then or gals, and then that's how you get a letter. It might sound very like 1970s. This is an old school way, but that's how it works. Okay, because you have to have connection. It's called social circle, right? Fawad. But they're not going to look at even that until you have decent scores. As I said, you can have the best fucking letter, like committee member's best friend or something. But if you have like a 246 on step 2, you're not going to get into dermatology at Yale. Fawad, you got any pets? The answer is no. I have no interest in pets. But when I was growing up, we had lots of cats. And dogs annoy me. Like, I don't know, like they're always loud and constantly barking. Like, I don't know why anyone would want a fucking dog. Let's see, Seima, what you think of FA? Question mark. Please, someone tell me, should I open it or not? I'm still new to step 1. I mean, I've said a lot that the FA era is over, and that's because it's not a numerical step 1 anymore. People say, Mike, why do you hate FA? I don't hate FA. There's nothing negative. Just we're talking about like, agnostic views on things that you should use versus shouldn't use. And FA is crafted for a numerical step 1 where there's a lot of superfluousness in there. So I think that per unit of study time, you're better off using my PDFs, which are more just tailored to the NBME exams rather than like 50 factoids to learn one that might show up on your exam, as with FA. Nassan, I appreciate everything. You guys can do a like on the live stream. There's 58 of you here, only 23 have liked the live stream. So there's those of you here who are like, okay, well, I know you're saying like the live stream, but I'm not going to like it. That's fine. Don't like my fucking live stream. No problem. Hi, Mike. I appreciate everything you do. I know I don't have the right to ask this, but could please do more PowerPoint lectures on more challenging topics? Question mark. That would be amazing. Yeah, I mean, you're right. I could. I just don't have interest. I mean, same with the whole like HUD asking about, or you said he's waiting for the repro updated chart format repro PDF. I could pump out like world class PowerPoints every day. World class. Okay. No fucking interest. Okay. But I mean, if you want to, I don't know, send me like zero point 0.1 Bitcoin a day, if you want to do that, you can DM me on Instagram. I'll send you my hard wallet address, and you can send 0.10 Bitcoin daily. And every day I'll pump out a new PowerPoint for you. World class. How does that sound? Sarah Fares, Pete's shelf in 10 days. Any advice? Uh, yeah, I would make sure you know the 8 PEDS CMS forms, the NBME subject specific forms, very fucking well. You should have done those twice prior to your PEDS shelf. So obviously I finished you're 10 days out. I mean, you should have finished the UWorld or Amboss question for PEDS. You should have finished my PEDS PDF. You should have finished my PEDS playlist for the MCQs on the YouTube. And you should be finishing or have finished the PEDS 8 CMS forms twice. That's how you get high pass honors on PEDS. Muskin MGN. Hey, Mike, you said score 40s in UWorld is bad, but what if we are doing random, still getting lows? Does the score matter? I said obviously 40s is bad for QBank, 50s is borderline, but still bad. 60s is good. But I've said I don't care about your exact scores in QBank. I don't care about your exact scores in QBank because regardless as to if you're doing shitty or doing well, the trajectory is still going to be that you finish QBank anyway. And then when you're done with QBank, you're going to do the NBME starting with 2021. Or for step 2, 6 through 8, you're going to do. You'll do the CMS forms after QBank for 2CK followed by 6 through 8, but that trajectory is the same. So you just got to continue through QBank even if your percentages aren't good. And you can use my PDFs, my YouTube MCQs to improve your knowledge base so that your subsequent blocks in QBank are better, right? Ahmed, and I've said do my PDFs, YouTube MCQs simultaneous to QBank, where you do your QBank 4 blocks of 10, what's 40, untimed tutor random in the morning, lunch, then the afternoon is my PDFs, my YouTube MCQs, and that can be subject specific. So you say, well, if I'm going through untimed tutor random, like you said, how am I going to learn my concept? I want to do like cardio. I want to pack punch on my cardio or my renal or something. You're going to do QBank random the morning, the 40 questions, 4 blocks of 10 untimed random, as I said. But then the afternoon can be your quote unquote subject specific phase of the day where you do like my 10 pages for my renal PDF plus, let's say you binge watch like 8 renal cues from my YouTube MCQ playlist. So that's like your subject specific part of the day, quote unquote. But like the mornings are still your untimed tutor random going through QBank. And I like that because that builds macro retention the best going through untimed tutor random. The only time I have ever a student go through like subject specific QBank is if like he or she's having problems with actual school. Like a student comes to me and is like, I failed MSK last semester. I can't fail it this time or something. I'd be like, well, we'll do the MSK questions subject specific on QBank, but I don't like that. The caveat I issue to a student is like, well, just know that as you get closer to the step, eventually you're going to have to revamp your MSK because you have no reinforcement over time. Let's say. Ahmed, if someone did MBME's 1 to 31 for step 1 and nothing else, what score would that person get? I mean, we're talking, you say everyone's testing ability is different. Yeah, I'm thinking GPT plus old MBME's 1 to 19. Yeah, but the caveat I've issued for ChatGPT is that it gets answers wrong sometimes. So never use ChatGPT to like say what's the answer A through E. Don't do that. It'll get questions wrong in USMLE. It passed USMLE, but it'll get questions wrong. What you want to do is already know the answer. Okay, so you say, I know the answer is D, and then you copy paste that MBME question into ChatGPT, and then you say like, I don't understand why it's like D. Can you explain? It explains to you, and then you're like, I don't understand why A is like wrong though, and it will explain that to you. This isn't a joke right now, guys. If those of you don't use ChatGPT, if you start using it, you're like, what the fuck? Like I didn't realize this was like so good. But another caveat is It's also wrong even sometimes with things it says. So if it gives you an answer before you say, okay, that's it, that's the conclusion, you have to say, are you sure? And it's like, apologies. Actually, I'm the exact fucking opposite of what I just said. You have to say, are you sure? Are you sure? And it's like, yes, I'm sure. This is it. And you're like, cool, that's the answer. That's literally how you use ChatGPT right now. Okay. And you say, well, that sounds like inefficient, or I don't like that. Well, you got to think, that's still better time consumption, more efficient than using like Google and searching around through like Wikipedia and trying to, find that info on your own. So you have to learn how to update yourself with technology. Some students who are resistant, who aren't using ChatGPT for their studies, they're the same students who are going to be using like, they're not going to update their technology when they get older, like old people now who still read the newspaper, old people who still have like a flip phone or some like low level Android phone. Like they don't have like an updated, they don't have a new iPhone or something. That's how you're going to be in the future when like you're still using like Google and the rest of the world's gone to like fucking augmented reality, like Chat GPT 7 or whatever. Let's see. Hassan, I'm in the last 2 months of my preparation. I can't do all NBMEs as they are expensive for me. They're in our Telegram group for free, bro. They're in our group files in the Telegram group. Will redoing UWorld do me any good? Also, what is the best time to do your PDFs? No, I don't want you redoing UWorld necessarily, but I have to see where your scores are. If you take like NBMEs 2021 offline, you tank them, you get like a 189 equivalent or lower. I've said you can get the 3 to score conversions. Then I'd want you back on QBank, like incorrects for a month at least. The PDFs should be done alongside QBank prior to the NBMEs. So you guys who are in QBank right now, you need to be doing, as I've already said, like mornings questions, and the afternoon is going to be like the PDFs, the YouTube MCQs. Bruce Wayne, my UWorld score, 45%. And I will stop. Is it possible to pass in maybe 20 if I do your cubing PDFs for a month? I don't think so. I think going from 45 to 65 plus is very difficult in 1 month. I'm not saying it's impossible, but show me, be the data point. Show me, okay? Allow me to be an asshole, and because these are just based on like observations I've made with most people over time. So if I get a student who comes to me and they're like, I'm getting 45%, and I'm trying to take my exam in a month, I'm like, probability is low. So it'd be nice to have a good data point where I say, actually, I was a fucking asshole. There was this dude named Bruce Wayne in my live stream, and he actually got his scores up and passed from a 45 to a 65 plus in a month. And I was an asshole because I said things as far as like maybe he couldn't do it, but he did, and that's a data point, right? So show me Abcom 98. So DM me in like a month plus or whatever when you pass, and then when you're passing your NBMEs. Abcom 98. Once I start studying for the CBSE, I promise I'll try not to ask dumb USMLE questions, as you say. Hassan Tahir, I can only do 3 NBMEs. Which ones would you suggest? 29 through 31. I'm Nate. Hey, Mike, thank you for the lives. Thanks for being a member. I'm Nate. Ahmed, and I know you're a member because you're green and you got my icon next to you. Everyone else is gray. Ahmed Goshesh, good to see you. Hello there. Is it enough if I only do your PDFs in UWorld to pass step 1? The answer is no. You need to be doing all the MBA exams, 20 to 24, free 120, and then 25 to 31. You should also be doing my YouTube MCQs as well. You say love you, no homo. Okay, good. It's good to throw the no homo in there. Demi 3 on T. I've asked about CBSE preparation on a prior live stream. You said do the NBMEs, but is it possible to pass it using QBank? Your PDFs mainly highlight arrows and audio QBank. You're asking using QBank and your PDFs and audio QBank. I mean, that's literally like, well, okay. Yeah, so I've talked about the tetrad, right? The tetrad being QBank, PDFs, my YouTube playlists, okay, the MCQs, that's the audio QBank, and also the NBMEs. CBSE is a borderline scenario where students who are not passing, I want them to go through the NBMEs prior to their CBSE, because that's old. If they're going to get kicked out of school if they don't pass CBSE, they're going to have to go nuclear and take all the NBME exams. But if a student is significantly below pass on the NBMEs, on any of their practice material, especially the NBMEs, they take 1 or 2. I don't want them burning through and wasting all the NBMEs if they're going to have another shot or 2 at the comp. Okay, so if your comp's in like 3 weeks and you're getting like 50%, let's say on an NBME 20, you're not going to pass comp in 3 weeks. Okay. So I don't want you burning through all the NBME exams. You're like, well, Mike said that that's how I'm going to get my score up the most. You're right. But you're not going to go from like a 50 to a 70 in like 3 weeks. And you're just going to use up all the NBMEs. The purpose of QBank is to get you to pass level so that then you can use the NBMEs to like build a buffer and get you significantly more above pass level. You shouldn't be using the NBMEs to get you above pass level, because if you don't get above pass level, you've now wasted all the fucking exams. Okay. I don't want to see that. So if you're significantly below the pass, I don't even like bother. I don't feign that a student's going to be able to even like pass. I just say like, you're not going to pass, and it's very unlikely. I sugarcoat it a little bit more, but it's not really. I'm still a blunt asshole with like basically all my students. And then I'm just like, let's, be a data point for me and show me that you can pass. Otherwise, like, probability's low. And, I don't want you burning through the NBMEs. You're just going to do QBank. Equa Janur, but is it okay to just do the high yield arrows PDF instead of the rest of your PDFs due to limited time? Well, I said high yield arrows is probably the most important if you don't have time for anyone. Krishna, sir, I need to give you world self-assessment and step 1, or I'm going to be 20 or 31 enough. No, you don't have to do UWSAs. I've said that I don't prescribe UWSAs at this point. I don't. The only time I prescribe UWSAs is if a student has already burned through 20 through 31, like an example, like I mentioned before, and we need other assessments now. We don't have them. I might use 19, 18, even older NBMEs, and the world self-assessments. I mean, maybe. I tend not to prescribe those. Robert Constantine, how many times do you think one should do a pass through your PDFs to know the content decently? Depends on your retention. Some people once, some people 2-3 times. You've done ethics, psych, cardio, but I want to do all of them for step 1. You're 2 months to go, 40% UWorld done. Ooh. Yeah, you need to pretty much like, you're either going to do 40 per day in UWorld and get through all my PDFs in the afternoon, or you're going to do 80 per day in UWorld. You're not going to get through all my PDFs. I would say for you can do 40 per day and get through my PDFs, not finish all UWorld, but then see how you go on the NBME exams. I think my PDFs for some people can beat the effect of UWorld. It's only people who like, I kind of analyze their situation, say I think your current low scores are from like not having done enough questions, that I can maybe push them to do 80. I say you're a student where I want you doing 80. I feel like in your case, maybe I'm going to have you do just more of my PDFs plus 40 a day for the next month. And then starting a month before your exam, you're going to do the NBMEs. Let's see, Muskin MGN. Also, I'm doing your PDF system-wise. Would you suggest doing your high-yield arrows PDF? Yeah, I mean, I said that high-yield arrows is the most important PDF. Ruben Reyes, hey Mike, our school requires us to take a proctored CBSE. Would you recommend doing entire UWorld QBank first, then do CBSE? The answer is yes. You should be done with UWorld before you have taken your comp exam. Abdul Rahman Amdi, guys, give the video a like, coming in the live stream. Give the video a like. Abdul Rahman Amdi, I want to start by my USMLE prep. Step 2 prep, going through your step 2 PDFs at the start of the preparation for step 2 is good, or should I use them at the end of prep? I've said a million times that you're going to start from the beginning of your prep with QBank. Okay. You're not going to do any pre-reading for QBank. You're just going to start with QBank. 40 questions, and then my PDFs, my YouTube MCQs in the afternoon. Okay. That's how you're going to start with step 2. You're just going to accept that you're going to get shittier percentages in UWorld to start. Rudra, hello, Dr. Mike. Thank you for the Q&As. Just love these sessions after rotations. I just come and start these sessions. It's amazing. Psychiatry shelf, what material to use? High yield psych PDF and UWorld questions. Do we use anything else? The answer is yes. You're going to do the 7 psych CMS forms. I believe there's 7. And you're going to do all of them twice. And you can also do the neuro forms for psych, because there's neuro overlap with psych. So you can also do the neuro forms as well. Muskin MGN, would you recommend for farm? What would you recommend for farm? I'm not able to memorize what to do. I've got obviously free farm modules on my website. There's like 50 of them. If you go to the free stuff tab on my website, scroll down below the PDFs, you'll see high yield modules. There's 50 farm modules there. You can do those. Those are free. I've got my farm playlist on the YouTube. It's fucking amazing. So you should do the farm playlist on my YouTube. Those MCQs, do all of them. Your farm's gonna get really good. And of course, I have paid FarmMonkey, okay, but it's paid. Truth teller, do you think it's possible to pass step 1 without knowing the biochem metabolic pathways such as glycolysis, gluconeogenesis, etc.? I keep getting all the questions wrong on those topics. You're probably getting the questions wrong in QBank, I imagine, because the NBME questions are super easy on those topics. Like the the actual USMLE, the NBME doesn't test you on like gotcha factoids on these on these biochemical cycles. Like what they'll do is give you like they'll give you various substrates in glycolysis and then show you like a subsequent substrate in glycolysis where the synthesis was significantly decreased. And then they'll say like which enzymes fucked up. And the answer is, well, it's just that like enzyme that separates those two substrates. It's like, and you'll easily be able to infer it. So it's nothing you need to like freak out about. Those types of questions tend to you can just use lateral ability to inference or to infer in order to answer them correctly. Krishna, about AB, you may question about anti-Kel antibodies. I have made a question or two about anti-Kel. I have. You just need to know it's a minor antigen on red blood cells, right? So it can cause hemolytic disease in the newborn. There's a question where like on one of the OBS guide forms where the answer is determine Kel's status in the dad, because it's like woman in subsequent pregnancy. I think she was like Rh positive. So it wasn't hemolytic disease in the newborn due to Rh, but there was still hemolytic disease in the newborn. And the answer, and they determined like the Kel titer was like high in like the fetal blood or something. And the answer was like, get the Kel status of the dad, something like that. HUD, that's a long discussion. I could talk about that more, but I'm not going to elaborate on that right now. Let's see. HUD, when solving UW, it's like you write like a fucking ESL, and then I have to waste time like trying to like understand your English here. You're saying like when you're doing a Euro question, do you have to read the explanations for the wrong answer choices? The answer is yes. You're going to read all the explanations for Euro. Let's see. You don't have to obsess over them though. You're not going to like memorize the explanations. Just breeze over them. Ankita, what's an acceptable percentage of UWSA2? I don't give a fuck about UWSA2. We want to see 205, 210 plus. That's probably going to be like mid 60s and above. SM7, is your 1 rep max bench press higher than your step 1 score? The answer is in pounds, yes, in kilos, no. Abdul Trot, do you recommend? No, I don't. The 128 man. Hey, Mike, would you recommend we learn auscultation questions in step 1? Questions, audio files? The answer is no. In my cardio PDF, I have all the murmurs there written verbally. So I've said in prior live streams that the way you approach murmur questions is you don't have to like get on fucking YouTube listening to like, this is what aortic regurg sounds like. What you're going to do is just verbally know what they're supposed to sound like. So you say, well, I know MVP, mitral prolapse, is supposed to be a mid-systolic click. I probably wouldn't be able to hear it if I heard it because I'm not good at that stuff, but I know on paper, verbally, it's supposed to be a mid-systolic click. So what happens is you get into your exam, you got a question on Marfan syndrome. It's obvious Marfan syndrome, and it's a stethoscope question. You're like, fuck, I like don't know. I hate these types of things. I don't think I can hear anything. But you know, because it's Marfan syndrome, right? Like Ehlers-Danlos Marfan syndrome, connective tissue disorder, myxoma degeneration, that you should be looking for a mitral valve prolapse anyway. And then you say, well, I'm going to move it to the mitral location, and I know it's supposed to sound like a mid-systolic click. So I'm just going to listen for that. And you're literally going to hear like S1, loud click, S2, and you're like, well, that's it, because you knew to look for it. Okay. So that's pretty much how the majority of those questions are going to work. Okay. Something else they can do for murmur questions is like give you no murmur whatsoever. And the answer is the kid is allowed to return to soccer practice. Let's see. Ayad like if you were worried a kid had Hockham, you would be hearing a systolic murmur, right? Due to left ventricular outflow tract obstruction. if you were worried about Hakan. So if there's no murmur like that, then you know the kid can return to soccer practice. Let's see. Hey, when to choose reactive thymocytosis over essential thrombocythemia? Yeah, the question you're thinking about on the NBME is it's a terrible question. Uh, the answer is essential thrombocytosis for that question. They give you like a platelet count of like, so what's going to happen is they'll usually give you a platelet count. They'll say it's pain in the fingertips, and they'll say platelet count 1.4 million. Okay, normal is 150 to 450,000. You're like, what the fuck? Why is it 1.4 million? And they'll say there's megakaryocytic hyperplasia. That means essential thrombocytosis. Now, obviously, reactive thrombocytosis would be, let's say, an infection, like endocarditis is classic. So they tell you, like, you get endocarditis, classic, fever, IV drug user, let's say, with a murmur, and then you'll see platelets are 900,000. You're like, what the fuck? That's just reactive thrombocytosis. Now, you could easily say, well, if you have a neutrophilic shift, you had a scenario where you're not sure, but there's like a neutrophilic shift, then that would presumably be reactive thrombocytosis. But I think there's a question on one of the NBMEs where the answer is essential thrombocytosis, even though there's a fucking neutrophilic shift. And it confuses every fucking student because you're already talking about minutia diagnoses. And then on top of it, they give like an atypical presentation. I think for that reason, I think the reason it was essential is because they said there was megakaryocytic hyperplasia. Whereas in reactive thrombocytosis, you don't have megakaryocytic hyperplasia. You just get release of extra platelets from the bone marrow reserve pool. That's what it is. Curtis McCannabis. Yes, Mike, that's actually my last name. Jinty Gibson. What's up, Mike? How's Japan? What's going on? Angela Zavaro. Good start of our sessions today, Mike. Thanks, Angela. Alvaro, 37NF. Mike, I got 247 AMBOSS self-assessment 2 months ago. Took NBME 14, 237. Today, WTF. Do you know if AMBOSS essay? No, I don't want to hear about your bullshit AMBOSS self-assessment. You're using like assessments that have no role in USMLE prep. Abud, who gets the 273 in step 1 in your website main page? How about I disclose like information to you about prior students? How does that sound? How about you have patients in the future, and then I come in and I say, who was that patient you had who had that like high blood pressure or whatever? Who was that patient that you had? Oleg Kim, hi there. Insomnia Mania, hi Mike. How can a high score IMGs go unmatched? Entitlement. I would say that it's because you can't have delusion where just because you get a 274 that you're going to get into radiology at Stanford. You can't have fucking delusion entitlement. So let there be no wild confusion that you're going to have a lot of people with 274s in the United States also applying to these positions who have research and all this other stuff going on. So you have to apply broadly. Okay. It would be not applying broadly enough, and it would be not applying the transitional / preliminary years. And that's pretty much what it is. Oleg Kim, what is easier to match, IM or FM? The answer is FM, but they're both, you can match easily into both. Crypto trading with Will. What am I? I see your subs going up. I bet you'll have 25, 29K by December. Definitely not, dude. Absolutely not. This is like peak in the summer right now. That's like my observation with analytics. Thing is like things get faster kind of in the summer and then they trail off again in terms of speed into the fall. That's normal. That's how USMLE cycles work. People sit all year, but like you get a push in like May and June. I'm not entitled, but 25, 20K, 25, 29K, I'm very, very sure that that's not going to happen by the end of the year, but I appreciate the optimism. Maybe I'd say 20 is like an easy target by the end of the year, because that way I know I'm going to hit that by the end of the year, but I'm not disappointed because it's, if it's slow, because that's a reasonable goal. Let's see, Abcom 98. What do you do for digital entertainment? Do you play games? No. Watch YouTube? Not Netflix. No. YouTube, like, yeah. I've been like watching golf lately. I cycled through sports. I was watching basketball earlier this year. Golf sometimes I watch right now. Maybe I'll go to football next. I just like baseball. I go through different sports. I cycle. I also watch some like crypto influencers. I watch some podcasts. Krishna Pro Max, you are. I do have a Pro Max right now. I have a 12, only an iPhone 12. I'm waiting on for the 15 to come out, then I'll upgrade. Username A, Mikey, how's it going? A quick question. I don't think Halo, this notion of Halo effect, that's a troll for username A. Elijah Oakland. Hello, Mike. How do I use your paid Anki versus free PDF? What should be priority, like 4 weeks to exam? Um, well, you should be focusing on the NBMEs right now, and you should be done with my PDFs by the time you get to the NBME exams. Like I've said that you should be doing my PDFs while you're going through QBank. That's what I've said. I mean, I'm flattered if you want to pay for my Anki and do those. Like I'm flattered, but like, I want you focusing on the NBME exams in the final month, and you got to know high yield arrows. And after you spend 8 hours in the day doing Anki, you can do, or sorry, doing an NBME. Of course, you can do like my biochem farm Anki for sure, but I just don't want it to be where you're waking up and you're not working on the NBME exams. You're spending all day doing my Anki. I don't want that. Louder milk. How do you come up with a username like that? Louder milk? Is that what that says? Like how do you develop that? Like what thought process? Like what is going through somebody's mind when they like develop a username like that? Just past step one, thanks to you. Quick question for step two, how to memorize the new information in UWorld. Should I make flashcards? The answer is hell no. You're not going to make flashcards. Jinty Gibson, you're hilarious, man. Love watching you roast everyone. Jamal Mughal, did anyone ever tell you you look like random person? I don't know how to pronounce their name. And the answer is no. No one's ever told me that. Dusan Vlahovic, I have no idea who that is. Jeesley, hey, on bone tumors, when do you biopsy? Yeah, that's a funny question, Jeesley. I know what you're talking about because there's like an osteosarcoma question of the ankle, and the answer is biopsy, right? They show you like they show you like three X-rays on one of the questions, and the X-ray all the way on the right shows you a lesion on the ankle, and the answer is biopsy. That's like kind of straightforward. You're like, okay, like there's a supposed like osteosarcoma there, whatever, it's biopsy. Um, and then there's another one where the answer is MRI. Maybe I have it flipped. You're like, actually, Mike, I'm just saying I know what you're talking about because the NBME like it reneges itself. It like goes back on itself because there's literally an NBME question for 2CK floating around where they show you an X-ray of an osteosarcoma and the answer is biopsy. And then there's literally another fucking NBME question, and these are both new questions for 2CK, where it's osteosarcoma and X-ray, and the answer is MRI. Biopsy is wrong. And then it's like, how the fuck do we like say which one it is? Neither patient is like has B symptoms or anything. You know what I'm talking about. So it's a bit strange. That's why people they don't get like 290s because you can like it's like what are you supposed to say to that? Jinty Gibson, golf is great, man. I mean I think golf is like pretty like I mean right now I'm watching a golf phase. I don't particularly like golf. It's just I'm watching it right now. You should come to Scotland. Okay. Yeah. Um, are you in Scotland? You say come to Scotland. Are you in Scotland? Insomnia Mania, does influence connections nepotism play a major role in matching? Well, yeah, I said yes. I wouldn't say influence. I would say like nepotism. If your scores are satisfactory, like nothing will override shitty scores in class rank. You have to meet their requirement first. You have to. Then when they start looking at you as a person, they'll look at your letters. They'll look at whom your letters are from. So they can look at that stuff. But as I already said, you can have like a letter from the best friend of the program director at like, at a committee. But like if you have a 246 on step two, you're not matching the dermatology at Yale. Okay. They're not because you're not going to meet the numerical requirement where everyone there has like bare fucking minimum, let's say 250, and 250 is still low. It should be like 260 minimum. Um, minimum, pretty much. I would say even high. I'd say 260, yeah, minimum for those upper, and that would be considered low. Like if you matched it with like a 260 in like Durham or something at like Yale, you'd be like the lowest in their program, and it would probably be from like because you got a letter. Jinty Gibson, do you like football as in soccer? The answer is no. Like growing up, I liked it. I said in prior live streams that like in elementary school, I liked soccer. Nobody else did. So like I was really into soccer and I was like good at it. But like everyone in my like classes like hated soccer. Everyone played like American football. And so I didn't grow up with soccer. And I was thinking like, You know, had I grown up in fucking Brazil or something, I would have been like, I think I would have been like a good soccer player. I just didn't have those influences growing up. But I don't like necessarily watching it either. It doesn't really do anything for me. Rudra D, apart from medicine, what other interests do you have? I have unconventional interests. How's that for like circumventing the question? I have unconventional interests. Let's see, Louder Milk. Is the micro Anki coming anytime soon? The answer is no. I have no interest. You know, someone said, like, is the repro PDF with chart form coming soon? The answer is no. Um, you know, but if you want to DM me on Instagram, and I'll send you my Bitcoin hard wallet address. If you send me a Bitcoin, I'll have world class micro Anki done by the end of this month. Okay, because I'm going to New York at the end of the month, so I could knock out world class micro Anki. But send me a Bitcoin, and I'll do that. Otherwise, maybe like end of the year or next year. Reham, hey Mike, is it true that every 2 to 3 months they cycle step one questions and some people might get unlucky and have a bad test? Just wondering. It has nothing to do with them cycling questions. Like you could literally just sit in one cubicle versus another, or go in like one day earlier versus late, and like that's going to determine a random form with a question allotment you happen to know versus not know. So it's all a toss up. It's all a toss up. Has zero to do with their cycling of questions, quote unquote. Louder Milk, it's a TV show. Adam K, interesting build. Interesting build. Louder Milk, how do I memorize the new info? Should I write it on the notebook feature of UWorld? How do I memorize the new info? Should I write on the notebook feature of UWorld? I don't really care what you do. I said like don't annotate. And I think annotation is like a waste of time for the most part. Just like read. Just read. Alale Mosavi Nezad. High average 50s in UWorld with 60% complete. Last time gave me 31 was 50%. You just wrote 50 3 weeks ago, doing 40 UWorld queues per day and reviewing incorrects. Do you think I can pass them 1 to 5 months? Yeah, months, yes. So you're 60%. What you got to do right now, Alale, is not do another NBME until you're done with UWorld. You got to finish UWorld. It's going to take you another month. And then I want you doing NBME 31 again, as though you've never done it. And we're not going to worry about your score. You're just going to do it for like review. You're still going to get a lot wrong. You might get like an 80% on it or something, but you're still going to review the whole thing. Then I want you doing NBME 20, and that's going to be the litmus test for like where you're actually sitting. We'll see how you're going on that. If you do well on it, you can just move through the NBMEs and sit in literally like 2 months from now. Ahmed Gohesh, Gaucher, nice PDF style. Jinty Gibson, yeah, bro, I told you I was from Scotland before, and you said you spoke to a redheaded Scottish girl in a park and she was obsessed with politics. That's true. Yeah, it's true. Okay. I mean, I remember telling that story. That was like a long time ago then. Yeah, I mean, I was in Australia, and like I was in a park next to my place, and I must have been like 26 or something, and like I opened some like redheaded like I don't know, cute girl in a park, and we started talking, and she invited me to her place like on the spot, and we go to her place, and I was like beta at the time, like we didn't hook up. Like looking back, that's like such a joke. That's like laughable. But young dudes have to like mess up like that. But she was like astonished that like I didn't give a fuck about politics. Like she was like, everyone in my family is obsessed with politics. I love politics. She was like heavily, heavily political. And like I was like, I don't give a fuck. Like that's what I was saying to her. I was like, I don't care about politics. She was like amazed by that. But yeah, the only reason I remember that interaction, as I just said, is because I was like, for some reason, I was able to say hi to her, but I was still, so I had that ability, but I was still like too young to like be able to convert in that situation. That was like, that's what young guys mess up like that. Kevin C. Tips on repeatedly missing small important details in long Q stems on NBMEs due to anxiety. Maybe I was 25. By 26, I was already like a fucking like I was a beast. 25. I must have been like 25. Kevin C. Tips on repeatedly missing small important details in long Q stems on NBME due to anxiety, not test fatigue. I don't really get anxiety, so I can't relate like that. Like anxiety doing questions, like um, I don't know what to say. Like I've articulated before that like you can't be emotional about these things as a dude. If you're like in the middle of a question, you're like emotional and you have anxiety, that's a problem, and you're gonna get weeded out as a result. Like I said, that the process of studying for USMLE is not just one about augmenting your knowledge, but it's also about like psychological ability to be stable in a situation, right? When you've got like, you can't be in the middle of a surgery and be like emotional about like some external stimulus. So if you're in a question, you have anxiety, and that impedes uh, your performance, that's like a screening mechanism, because you know you shouldn't be a surgeon if you're going to get anxiety in the middle of a surgery over something, or you got a patient in front of you in a family med clinic and some stimulus presents itself, bad news, and like you're not able to handle that in front of the patient. So you got to be able to keep your cool in these situations. Javid, sir, NBME explanation not that good. I agree, they're mediocre. Use ChatGPT, as I said. Loudermilk, another quick question. How can I ask for a letter recommendation from where I'm rotating and applying next year? It's a long discussion. It's a long discussion. I don't really want to do that right now because I'm only going to make this live stream an hour. It's going to be a very short live stream. But I've said that you're going to go to, like when you're looking for a letter, your focus should just be helping the team. You're not going to follow around and stalk the attending as some like, obsequious sycophant. You're not going to do that. You're going to follow the intern. You're going to cater to the intern and help him or her as much as you can. And that eventually will get relayed up the food chain. Okay. Like when an attending is going to give you a letter, they're not like, you're not going to impress the attending with anything, most attendings, if they're not pedagogical and actively engaging with you, their interpretation of what would make you an effective like student is you just helping the intern. Like if you're there and you're trying to like cater to him or her as the attending, they're probably just like, all right, you need to like be like, you need to know that your role is to help the intern. You got to be like astute to that. So if they observe that like you don't even give a fuck about them, you're just like, the intern's pet, you're just helping the intern, you're focused on the intern, helping him or her, that's like what gets you a good letter, because that's how you're most effective on a team. Hey, Adelie, how common is skating in Japan? There's niches for it. I don't see a ton of people skating like on the street. Like I sometimes, but like um there's niches. Like there's parks that you can go to where obviously you're going to see that density. But like it's not I don't know. It was more common like per capita, I would say, when I was in Australia. Like when I learned skating in Australia, uh more people skated as far as I can recall. Laudermilk, that's funny, Anthony. Anthony Pompliano. What about Anthony Pompliano? What about him? I mean, yeah, he's got like a lot of energy. He's like a very forceful communicator. Some people I guess like that. He's Italian, right? Clearly the name, but like he's obviously a crypto dude, but he's got a very like forceful energy. Let's see. Elijah Oakland, thanks for your time and effort. So NBME retired step questions with some minimal repeats question mark. The concept, which is the educational objective, is always repeated, continuously tested on question mark. The answer is yes. Not only are there repeats on the real deal, so when you do all the offline NBMEs, you're going to see repeats on the online NBMEs, and you're going to see repeats from all the NBMEs on the real deal. It's how it works. But even if you don't get an exact repeat that you can recall, the concepts repeat. And by the way, students will sometimes say that they didn't see repeats, even though they did. If a question didn't give you a problem, you're not going to be inclined to remember it. And the other thing is, I know this objectively, that even if a question you got wrong, you're still not likely to remember it. I know this because I've sent questions to students before that I know are repeated and they've missed them. Okay. Like they'll get a question wrong that I send them. And then, like, 2 months later, 3 months later, when they're in the NBME exam and they send me some of the questions they get wrong, occasionally there's a repeat in there. And I'm like, I fucking sent you this question like 3 months ago. And they're like, I don't remember. I'm like, yeah, I know. But okay. So that happens. Um, how long do you want to stay in Japan? Where else would you like to live? I'm a permanent resident in Japan, so I can stay here for life if I want to. I can move elsewhere and come back if I want to. I can't anticipate these things as far as where I would live. I can't. The reason I know that is because if you told me while I was living in like university in Boston that I'd be moving to Australia, I would have told you like, oh, I didn't. That's kind of a crazy future. And I lived in Australia 7 years, and I thought I was probably going to be living in Australia or going back to the U.S. or something. So if you had told me I was moving to East Asia, I'd been like, no way, am I going to be doing that? I've been here over 7 years in Japan, so I don't know. I really don't know. Can't predict these things. I don't devote like mental cycles to that because I'm 36 and I realize that like you can't predict life that way. Like I don't really, if people are like, where do you see yourself doing? Or what do you see yourself doing like 5, 10 years, like that? My answer is like, I don't really fixate on that. I don't really care. Like I seriously, like that's how I am. Cause I just know that you can try to come up with these ideas and like life doesn't work like that. It's just not how it works. Let's see. Why are you saying random fucking people in the chat? Outcome 98. Mustafa to use Anki. I'm gonna end this live stream because let me just see because it's 6 a.m. here in Japan. I gotta go to the gym. Let me see. I said I was gonna do an hour. I did my hour. It doesn't have to be a 3 hour live stream all the time, right? Let me just see if there's any final questions here I want to look at. What specialty are you doing? I don't Tosin. I don't do a specialty. I'm just USMLE. That's my specialty. People ask every day, like I'm practicing doctor. I graduated med school, did my master's in Australia as well, but I just do USMLE. You should do a podcast with Andrew Tate, Loudermilk. Well, we can't go a live stream. There's never a day that if everyone people ask me about Andrew Tate every day. If you want to get like real fucking like people real fucking juiced up and entertained, just mention Andrew Tate. But people ask me about Andrew Tate every day. Okay. King of support. If you had to choose when is the best time to get married in med school or in residency, I'd say it just depends on you as an individual. There's no right time. I'd say people should be having kids earlier than later. That's what I think. I think you just have to like have kids earlier. I think females having kids late is a bad idea. Alele, and then you go into all these like technicalities regarding your fucking like massive fuck. I already answered like your stuff, didn't I? Another cue for a friend, please. It's too like jumbled. 51% U World completed, 61% average. Last one to me, 31 was 3 weeks ago, 71%. Exam in 1 month, any advice? Like laughable. I mean, 71% in the NBME is good. So just that's solid. I said 70 plus is like really good. So just like go through 20 through 24. 3 weeks ago. Yeah. So I would just do at this point 2024 free 120 and then just do 25 to 30 at this point. Ayad, do you think money can bring happiness? The answer is yes. Absolutely yes, to an extent. And I've said this because money amplifies who you are. It doesn't change who you are, but it increases your ability to give. That's the thing. That actually increases happiness a lot. Being able to give to people, buy things for people, not buy things or send money to people, where that to you is no longer a lot of money, but you know that it used to be, you would, when you were younger, it used to be a lot of money, and you notice some other people that that's a lot of money, and that can increase happiness a lot. You being able to give. That I'd say is like the major thing. It's you being able to, I'd say the two major things having money brings happiness is you can give a lot more. That's the main thing. The second thing is you don't worry about small, annoying bills anymore. That's the thing. When you're in your 20s, you worry about that stuff. You think about like how much your Wi-Fi is, how much your phone bill is, how much gas versus heat was for like a month. Like you look at those things, you think about those things sometimes. When you're in your 30s, if you can be fortunate, like you, and especially you guys going to be doctors, like you're not going to be thinking about those things. Like I haven't looked at I just have everything deducted automatically from my accounts, and like they could be wrong. They could be. I haven't looked at that stuff in like 2 years. I haven't even checked. I have no idea how much my phone bill is, or my rent, gas, heat, aircon. I have no idea how much I'm paying because I never check that stuff. I don't really. They could be charging me double. I'd have no idea. They'd be like, "Oops, we were accidentally charging you double. We've been taking out of your account for like a year now." I'd be like, I don't know. It's so I think not being able to worry about like small bills and stuff, and being able to give, that's like that definitely increases happiness. And being able to travel, like that's you don't need that much money to travel, but like that can increase happiness for sure. Let's see. You're just saying names you think I'd recognize since you have uncommon interests. Um, you asked ChatGPT about phase variation. Well, no shit, it's gonna help. Yeah, you got to use chat. You got to learn how to use ChatGPT, guys. I know this was a short live stream today, but it's six. It's after 6 a.m. here, so I gotta head to the gym. I got stuff I got to do. All right, so see you tomorrow. Well, maybe, maybe I'll be on tomorrow. Right? Been pretty consistent with these. All right, guys. See you guys.